In nursing, we have this policy that we've inherited, the 2 strikes you're out, right? So you fail 2 nursing courses, most programs you're out. And when I ask my colleagues, why is that? Why is that? The knee-jerk response is, oh, well, we don't want to take people's money if they're not prepared to be successful. But I will counter that with, but I thought we have admission policies, and if they're able to have the GPA, have the SAT, have all these, meet all these criteria, how do they come in? And now if they're not successful, the immediate response is, it's because you can't handle it. And it makes me think back to when the Institute of Medicine's unequal treatment came out. They said, you know, when we look at patients in the 80s and before that, we always blamed the patient. Your BMI is high because you're not eating the right foods. You have healthcare disparities because you're not taking your medication right. You don't follow up with your provider. It was this blaming and shaming culture. And then in the 90s, we tried to change that, and we said, okay, it's the system. It's access to care. And then when the Institute of Medicine's report, Unequal Treatment, came out, they turned the camera on us. Mm-hmm. They said, it's you as a healthcare provider. And I say all that to say, what lessons can we learn in academia that says, wait a second, we blame the students, we blame the schools, lack of resources. When will we look at ourselves as faculty and leaders and say, how am I contributing to a student's inability to progress? Because if we keep blaming the student, we will never put policies in place that make us look at ourselves and say, what can I do differently?
In the midst of this nursing shortage, to be turning away capable nurses because of that 2 strike you're out policy, it's problematic. How many techs do we know that would be wonderful nurses? How many clerks or ancillary staff do you know that would be phenomenal nurses? But something happened, there was a roadblock. And the same way that we turned the camera on us as practitioners to say, what can we do? And we looked at the social determinants of health. Well, we need to look at the social determinants of education. Mm-hmm. What are the policies that need to change to really get them to the finish line? If a student fails more than twice, is that a problem? Is that indicative of them not being a capable nurse?
In nursing, we are not leading or creating environments where we lead with evidence-based policies. We lead oftentimes with correlations. You will see across schools, if their NCLEX pass rate drops, the knee-jerk response is change the admission criteria. Why are you thinking that a correlation is causation? Correlations can lead you down a rabbit hole where there's no truth but darkness. And we see it play out. I remember starting at a school where I didn't realize it when I took the job, but their NCLEX pass rates were really low. So someone during the faculty meeting said, well, you know what this means? The state is going to come in and they're going to close us to admissions. Someone said, it's because we started letting them in. The university is making us bring them in and they are pulling down our NCLEX pass rates. That comment, I can't shake it out of my head. And I was a very young nurse at the time, young educator, and I just put my head down. And I didn't push back, I didn't respond, but I felt like they are blaming us because the NCLEX pass rates are low. Can you imagine if I said, oh, look, the majority of the females with blonde hair had low pass rates. What? The majority of people who were less than 5'4" had low pass rates. How does that mean anything?
There's a lot of bias in how the faculty are, how do they get to that 2 strikes in the first place, right? There was a student who identifies as Black that shared in one of her clinicals, she showed up late to the debrief conversation and her clinical instructor berated her and took off points. And she shared the reason why she was late was because she was with a patient and it was unsafe to leave that patient until the nurse came. And then observed the next week that a couple of students who identify as white showed up to debrief and nothing was said, right? there's so many underlying factors that aren't captured in how they get to those 2 strikes in the first place. How are we assessing students fairly? And then also, if we have these strict policies where nobody can be late ever, and there's no exception to the rule, then we're not taking into context their lives, their lived experiences, their car broke down, their kid's sick. We don't have the flexibility to let them be a person.
I had a faculty member who said, "We need you to support us." So whenever they lead with, "We need you to support us," it feels like you're doing something that we need to have a deeper conversation about. I said, "Well, tell me why you want to dismiss this student from the program." He's not following our attendance policy. Our attendance policy and lateness policy says if you're late X amount of times, you get an absence. And if you're absent X amount of times, you're out of the program. Why is the student late? Well, he always has an excuse. It's either because he's helping his grandmother with something, or his car broke down, or the bus was late. He's got 1,000,001 excuses. Why do we have this lateness policy? Because it's part of professionalism. So I said to this faculty member, "You're telling me that this student, an A student by the way, is late constantly, and he interrupts your classroom. And if we don't kick him out, other students are going to see that these policies have no teeth, and they'll all do just whatever they want." That's one way to look at it. But what if we met the student where he was at? And when you're talking about a student who's coming from poverty and they're relying on mass transportation, they lack the control.
Right.
Especially when the mass transportation starts at a certain time. But the bias is, if I showed up on time, you should be able to show up on time. You don't take into consideration my lived experience.
Right.
Now, I understand that people should show up on time. But if something happens that prevents you from showing up on time, where is the humanism?
Yes.
Right? I'm assuming that you're lazy, that you don't care about your education, and in reality, your bus was late,
Right.
or your train
Children.
stopped,
Yeah, they have
right?
other
Something happened,
responsibilities.
and we don't want to have that conversation because we know what happens when we're rushing. The bias kicks in. So now I just believe a certain thing about you, and I'm going to lock the door so you can't come in.
Yeah.
Are you kidding me?
terrible.
How do we get to a place where we think it's okay to lock a student out? That's a sign of shame on you, or I'm better than you and you will not disrespect me. Where is that coming from? We can't lock people out of the classroom. If someone comes in late, let all the people who come in late say the last row in the classroom will be for people who come in late. Get here when you get here. Try to get here on time. I think some of our professional standards are rooted in racism, rooted in the plantation mentality. I'm going to tell you when to get up, when to walk, when to stop, when to talk, when to be quiet, and if you don't listen to me, oh, you're going to pay a price. And that price might be you're out of the program.
One of the challenges, particularly when we were talking about equity and anti-racism work, is there isn't a lot of standardization. We say we're equitable, we say we have these anti-racist initiatives, but what does that really get us? And so I would love for a standard tool for that is created by BIPOC nursing organizations and leaders that schools of nursing have to use to review their policies, to review their admissions, to review their differential punitive practices that they use, so that when we're grading across the same standard.
There is definitely work to be done. We have to have the students enrolled. We have to remove those barriers. We have to hold the institutions accountable for that contract that they make to bring the student in. And then what do we do with the faculty that is holding the student out of the classroom, out of the clinical? They have to be held accountable.
You want to know if the hospital that you're going to have surgery at tomorrow has a high rate of infection. You are looking up Leapfrog and seeing if they got an A, B, C, like how were they scored? What if we had a Leapfrog for higher ed?
Yes.
That would be fabulous.
Yes.
And
What would it look like?
And not just looking at, which is important, diversity, equity, inclusion, but also racial justice, because those two are not the same. When we're looking at diversity, equity, inclusion, and racial justice, they're not the same. But we really do need to look at those things.
You know, in healthcare, we actually now have CMS, which is, you know, the federal government that pays most healthcare organizations. They have equity outcomes that they're holding institutions to, and that is going to impact their financial bottom line. And so organizations have a runway to get their baseline data, identify where the opportunities are. We know that zip code matters for health outcomes, for life expectancy. We know that zip code matters for disease processes. And so if you have your data as a healthcare organization, then you need to take action. You have to go into the community, like was stated earlier, and listen to the community on what are the issues. The answers are there. We don't need the healthcare system thinking that they know. That continues to perpetuate that structural driving mechanism. But you get out into the community and you understand what are the barriers, what are the challenges, and they, believe it or not, they have the solutions. And then put your money where your mouth is and invest in those solutions so that we can truly impact not only the health outcomes of the community, but the bottom line of that health system, because they're going to be held to that in the future. And that's where we'll get those best practices, and we can replicate that model very similar in academics.